Hello friends, welcome to my channel, Nurses Toolkit. My name is Prosper. I'm a registered nurse in the UK and in Ghana. On this channel we educate nurses and the general public. In today's presentation we are going to look at drug error. This presentation is basically for candidates who are preparing to have their UK NMC OSCE exam. And then it's also for nurses who are practicing in the UK and around the world. And so we're going to go through it. It is my hope that those who are seeing this for the first time, or those who have even been watching and have not subscribed, it's my hope that you subscribe, you like and share for others to also benefit. So when we talk about drug error, this is something no nurse will want to pray for on his or her shift. Now, with drug error, when it occurs, NMC expects you not to keep quiet. They expect you to take action. And so we are going to look at the points that we can write as candidates, and then what we can do as nurses when this occurs on our shift. So the first one is to recognize the possible consequence of error and the importance of patient safety, and takes measures to reduce harm. In other words, if there is an error, the first thing on your part as a nurse is for you to recognize that an error has occurred, and then taking measures to reduce the harm that this error will have on your patient. The next one is to check the stability of the patient by taking observations, informing nurse in charge and the medical team, and then seeking advice. In other words, when an error occurred on your shift, you make sure you inform a senior colleague on duty, and then you all discuss that with the medical team, and then seeking advice from the team as to what actions should be taken next. The next one is the importance of disclosing the occurrence to the patient and apologizing. And so you don't have to, you have to make sure your patient is aware that this is what has happened. And then you discuss with the patient the measures or the actions that you have taken, or the measures that you are going to take to make sure it doesn't have much effect on him, on her, or her. And then you apologize to the patient. The next one is to document events, actions and consequences in patient's records and incident reports. So with all that has happened, with all the actions that have been taken, you make sure you document everything in the patient's records, and then in the incident report. You make sure you complete an incident report. Our fifth point is to making sure you appreciate or recognizes the importance of reflection. And so after all this has happened, as a nurse, you have to sit back to explore. You ask yourself questions as to how the incidents occurred, what could have been done differently, and then you also try to see it as a learning opportunity, and if possible, to revisit drug administration procedures to be able to help you so that this occurrence do not happen again in the future. The other point is you adhering to the code, that is prioritizing people, practice effectively, preserve safety, and then promoting trust and professionalism. So these are the points that you are expected to write. My advice to you as candidates is that you make sure you go through, as you listen to this, you compare to what is written in the marking criteria, and then you come out with your own way of going about it in the exam. NMC is not interested in you copying what is written in the marking criteria. The most important thing is for you to understand the concept and the actions that is to be taken should in case this happens. And so make sure you come out with your own way of writing it, so that in exam day you'll be able to produce it. For those who are writing their exam in the next few days or weeks, my prayer and hope is that you make it once and for all. For if you have not subscribed, please do so and share for others to also benefit. Thank you, and meet you in one of our presentations. We're going to make sure we'll bring you all the professional values. Thank you.